Bear with me, y'all. I'm getting my phone set up. I should have did this before I pushed the live button, but... Hello. Hello, Facebook. Hi, Melissa. Hey, y'all. Hi, Shar. Hi, Shanna. Hi, Chauncey. Thanks for jumping on with me. For those of you who are already on, go ahead and share the video and let people know we're on. Yes. Hi, Concetia. You know that's what I do. Educate. Hi, Kendra. Hi, Pat. So, hold on. I should have did this part before I even went live. I'm going to share it to my other pages, and I don't even have Facebook up on my computer yet. So, I've been having a lot of people. Thank you, She-Jag. I appreciate you, too. I appreciate your support and watching the videos and stuff like that. Thank you. I've had several people in the last few weeks inquire about and even come in for consultation about reducing the size of their back size after they've had BBL. And so I knew this was going to happen. Thank you. Okay, help me. Sun Soraya? Is that how you pronounce your name? Sun Soraya? Thank you. Thank you, Kendra. So I knew this was going to happen, and I was saying this a couple of years ago. I'm like, this BBL thing, the Brazilian butt lift thing, is going to take a turn and go in reverse. I knew people were going to overdo it, which that's what's happening. People are getting ridiculous with their proportions and stuff, and some people are definitely regretting having got the right. The Jerry curl is over, girl. You must have been watching me for a long time, because that's exactly what I said. I'm like, the BBL is the Jerry curl. At that time, I think it was 2017 or something. I was like, it's the Jerry curl of 2017. Like, everybody wanted it, just like the Jerry curl was back in the day. Everybody wanted it. If you didn't have it, you were lame. And then all of a sudden, one day, in the blink of an eye, if you had it, you were. So now we're getting to the point where people are like regretful and, okay, I want to wear something more than spandex, and this thing is too big, and, you know, it looks too fake, and I'm embarrassed, and all this kind of stuff I'm hearing. And people coming in for consult and stuff, trying to see if they can get it reduced. So I like to... We're not talking of this. That's actually not the topic for tonight. The topic for tonight is alternatives. Like, it's an alternative to that procedure that is more natural in appearance. It gives you a better shape to your butt and make you feel a lot more confident in your clothes without, and even outside of your clothes, without the risk that comes along with the fat transfer to the buttocks, and also without the downtime as far as recovery goes that goes along with that surgery. So the procedure that I'm speaking of is called gluteal contouring, and at least that's what I call it. And you don't have to worry about not being able to sit for weeks and weeks after the surgery or anything like that. It's essentially just liposuction, where removing fat from certain places makes your butt appear rounder and appear bigger. So everyone is not a candidate for it, but a lot of people are. In fact, a lot of the people who come in for Brazilian butt lifts to my practice, I would say of those, at least I would say 60 to 70% of those people end up getting gluteal contouring and not a Brazilian butt lift. Gluteal contouring is less expensive. The recovery is much easier, and less expensive, easier recovery, and safer. So with that procedure, you don't have to worry about the risk of fat embolism or death from the surgery. Brazilian butt lift is known at this point that it has a really high death rate in comparison to other plastic surgery procedures. This is one of the reasons why I don't like to do them. It's safer to get Brazilian butt lifts if the fat is only injected into the subcutaneous plane, which is above the muscle. But a lot of times when people are trying to get these really large backsides, fat is injected into the muscle in order for the fat to live. So yes, Tara May. So when you do gluteal contouring, you can be awake for it. Some people do BBLs awake, but I don't. I do not do BBLs awake. I think you need to be asleep for that personally. That's my professional personal opinion. Yes, you can get liposuction without going under. At least in my hands, you can. So I wanted to talk a little bit about the gluteal contouring. I wanted to draw. Where's my... Oh, can you hand me that, Smalls? Good thing you were in here. After I did this setup, I would have never been able to get over to my book. I wanted to draw... I did this before in a live maybe a year ago, where I do a little sketch to show you like how gluteal contouring works. Okay. All right, hold on. Okay, so let's say this is a woman's body, right? This is her butt, back, belly. This is the thigh area. So a lot of people will come in with this body and say, I want a BBL, I want my butt to look bigger. They're like, my butt looks flat, da 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 da. And when I look at this, I don't actually see a flat butt. I see a butt that's hidden. So I'm gonna show you something. All right, so now look at this. Okay, everywhere that there's a dotted line, so here's her normal form. The solid line is her normal form. The dotted line is what I would etch away, okay? So I would take all of this stuff out between the dotted line and the solid line, and then in the front, you know, do liposuction and take this away. So now I'm gonna fill it in black so you can see this flat butt. You see it looks flat right here? Watch what happens to her butt when I show you the stuff that's taken away. Okay, now look, everything in black is removed with liposuction. This is removed with liposuction. And so now look at how round her butt looks now. You see how round her butt looks? And when you take the stomach in, and this is a 2D picture, right? So if this was 3D, imagine we take some off of her waistline. So now when that's gone and that's gone, you see how round her butt looks? Nothing was added. Nothing was added there. Most people make that form look better by doing this to it. You see those dotted lines? They'll go and add back there. When all you really needed to do was take away. You see where that black is? You take that away and now look, all of a sudden she has a rounder butt. You see that? And guess what? She can sit on that the same day. Because since only stuff is being taken away, we don't have to worry about killing the fat by having the person sit on it. Yes, you can do Actually, I did gluteal contouring and a tummy tuck today. My case this morning was liposuction of her back. I took 3 liters off this lady's back today. 3 liters off of her back. And 2,600 of those 3 liters was pure fat. It was phenomenal. I cannot wait to see how everything looks once her skin starts shrinking. Yep, Pamela Garner, nothing added, nothing taken, only taken away. So I did liposuction of this lady's back today with gluteal contouring, and then we flipped her over and I did her tummy tuck. You can absolutely do that at the same time. The recovery time for gluteal contouring is a few days. Now, you still have to wear your compression garment for 3 months, the same way you do with lipo, because it's liposuction, but you can sit. It's less expensive. It's a million times safer. You have normal proportions. You look like a person who just has a nice body, as opposed to a person who a stranger looks at you and says, ooh, 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 who did your surgery? If a person doesn't know you, they shouldn't be able to look at your body and know that you had plastic surgery. It should not be that obvious. Oh, hey, Jamala Moore. Hello. All right. What size do you have to be in order to get that done? Your BMI needs to be 33 or less. How can you schedule, Rosha? You can call my office. Now, if you got, what, about 12 more hours before my liposuction. Well, actually, that's not the lipo special. Just gluteal contouring isn't the lipo special. Never mind. Scratch what I said. Never mind. Forget what I said. You can call. You can schedule by going to www.ederabella.com and doing a consultation request on the site, and my office will reach back out to you and get you set up for a consult. Can you be intimate after? You can be intimate after 3 weeks. Like, that's just the standard guidelines I have my post-op patients go by in my office after surgery. No sex for 3 weeks. Yes, you receive massages after procedure, Kenya. Yes. Hey, Kenya. The lipo special ends tomorrow at noon. We close at 1. Tomorrow at 1 when we close. So it's almost too late to get in on it. Yeah, if you got the lipo special is basically about over. And the people who took advantage of the lipo special made out this week. I was doing consults like a crazy person this week to accommodate everybody. Tomorrow's the last day of the consult. So I don't know if there's any room to squeeze anybody else in for a consultation tomorrow, but hit up the website, www.ederabella.com, and my staff will reach out to you. And if we have any openings tomorrow, which I don't know if we do, but then maybe you can still get it. Extended 1 more day. Why did you wait? It's been going on since what, Monday? Tuesday? Tuesday morning.
When is it? Tuesday?
Tuesday I announced it, and then Tuesday night I went live. Yeah. And you know, I don't do specials that often. I only do it once a year. So when this is up, that's it. So. Can a surgeon miss a spot while doing lipo? Yes, technically. You've been sending emails, Kendra Wallace? DM me your contact information, and I will have my office get back to you. Not before and after, not before pictures or anything like that. Just your contact information. Okay, let me go back and see some of these questions. Why do some women say their vagina seems tighter after tummy tuck? I read about this in some tummy tuck groups. They're probably not talking about the vaginal canal. I'm assuming they might be talking about how the outer part feels when stuff is pulled tighter. And that's just because things are pulled tighter. I save all of my lives. Steve Fania. All of my lives are saved. I have hundreds of live videos. Okay, let me go back toward the beginning. Someone asked, are the doctors that do fat transfers injecting fat under or on top of the muscle? I don't know where they're injecting it. Every surgeon does different things. A lot of them used to inject it in the muscle in order to get more fat to live when people are trying to get these large expansions of their backside. But it is recommended, it is like recommended not to do that at this point. Because that has the highest death rate when you inject it in the muscle. That's how people inadvertently get fat emboli that go to their lungs and kill them almost instantly. So it is a bad idea to do that. Fat transfer to the hips is not as dangerous as the BBL because there's not like super big veins in the hips the way there are deep in the butt, and also within the hips, people tend to not be injecting it into the muscle. You don't want to be putting it in the muscle when there's big vessels running through that muscle. Sarah Parker, my location is in Johns Creek, Georgia. We offer virtual consultations, Chanel Walker. Thanks, everybody. Y'all been answering the questions for me. I was late. Okay. I'm just reading the comments, y'all. If you have back rolls, can lipo take them away and make your back flat? I see so many ladies complaining they still have rolls after lipo. That's a great question. So the back rolls are a little, I'm not going to say tricky because you do liposuction, you get the fat out. Sometimes people's back rolls are, I won't say resistant to liposuction, but don't completely go away. Like you'll still see the roll even though fat's gone. And that could be an issue of the skin. Sometimes the back skin doesn't, it's not as predictable with shrinking as the front. Sometimes people's back skin doesn't shrink, and so the roll will still appear to be there even though it's deflated. So sometimes that happens. If that happens, you may need some sort of skin tightening procedure to tighten up the skin to stretch it out so that the roll doesn't seem to be there. Yes, for awake lipo in my office, your BMI has to be under 30. What if you have saggy glutes? Is this a good procedure for that? No. If you have saggy glutes, this is not the procedure for that. If you have saggy glutes, like the skin, you'll have to do something to address the skin. I don't feel anything about inner thigh lifts. That's a good surgery if the person's appropriate. I feel the same way about inner thigh lifts that I feel about every other procedure. If you have excess skin that's hanging and stuff and you want to improve the contour of your thighs, that's a great surgery. Make sure the person who's doing it knows what they're doing. Thank you, Sabrina. There's treatments for stretch marks to improve the appearance of the stretch marks, LaShawn. Microneedling. There's other treatment called the intensive that I have, which is radio frequency and microneedling combined. Those are really good, and PRP is really good for stretch marks. Why would a doctor inject fat in a muscle during a BBL if they know it's a risk? Because people want their butts to be huge and they want the fat to live, and the patient decides to accept the risk. That's why. It's not just the doctor, it's the patients too. If people aren't asking for it, nobody has to give it to you. So that's why I do these videos to educate folks so that they can ask, they can be more reasonable in even what they're asking for and think about their own safety. Don't just completely trust somebody else. You have to be a steward of your own self. So it's not just the doctor. It's the patients too. Is it normal to have abdominal swelling almost 2 years after mommy makeover with MR? The abdominal swelling can last a while. It definitely lasts at least a year in almost everybody, like where swelling comes and goes. But it just depends on what you have going on with your body, like your size, your sensitivity to things like salt, things like that can make a person's swelling persist longer. All right, looks like the questions are slowing down. So I'm going to go ahead and sign off. I'm going to show you this picture one more time for a reminder. This line is her normal shape before any procedure. You can add fat, these dotted lines, to make the butt look bigger. Or you can take away, which is all the black that I removed. And you see how this seemingly flat butt here now looks rounder. And then when you flatten her stomach, it makes her butt look even bigger. That's gluteal contouring. Gluteal contouring is your friend. Gluteal contouring is very safe. Gluteal contouring is less expensive. It's like a win-win. It's not the surgery for you if you want your butt to be huge. It's not going to make you have a huge butt if your butt's small or normal. But it will make your butt appear bigger if you have a normal size backside, you've got a little fat on your belly, and you definitely have fat on your back and upper buttocks where it's not supposed to be. It will totally make your butt look rounder and cuter, and people will be asking you, did you get your butt done? People who know you will be asking you that because they'll notice that you look different in your jeans and stuff like that. So this is a great, safe alternative. The recovery is easy. The cost is better. The safety profile is phenomenal. It's a great option. I love to do it. I do it all the time. It's a great surgery. I'm checking these last couple questions before I get out. Yes, Keisha. All right, I'll go ahead. I'm gonna go ahead and sign off. I'm Dr. Myla Bennett of Adarabella Plastic Surgery and Medical Spa in Johns Creek, Georgia. You can reach me via my website at www.adarabella.com, or you can call my office at 678-325-0006. All right, bye.